Today is World AIDS Day, and the UN's World Health Organization has said that the international community has made extraordinary progress in the past decade in the fight against AIDS, but there is a funding crisis that could put all the gains to risk. Joining us now from Nairobi on AIDS in Southern Africa is health economist Teresa Guthrie, Trustee and Founding Director of the Center for Economic Governance and AIDS in Africa. Teresa, thanks so much for your time. We're told that worldwide about 34 million people have been infected with AIDS, but we're also told that infection rates are coming down. When you look at this figure, what does it say to you? It's a decline, it's an improvement, it's stabilization?
It's definitely an improvement, Lerato. I think we're eventually starting to see the results of our investments over the years. We've had a scaled up response that's been quite phenomenal across the world. And we at last can see that the impact of our investments in prevention and treatment and care and mitigation are actually having an impact. And we can say in the next few years, we should be reducing the infections dramatically. So that's all good.
So we're reducing infections, but we've still got a large component of people living with the virus. What does it mean to live with AIDS or HIV?
It means, right. Well, it means a lifetime of chronic medication and high costs that the government has to bear for that medication. It does mean other implications for your family and your personal life. But it really means that the government has to be committed to funding your chronic medication for the rest of your life. And the crisis at the moment, economically, and the reduction in donor funding and the global fund crisis means that some individuals may have to stop their personal medication, and that leads to resistance. It can lead to deaths and illness. So really the crisis has a huge impact on individuals with HIV/AIDS at the moment.
This funding issue, you've mentioned a variety of causes, the recession, the global crisis. What about the element of donor fatigue? Is there a sense that donors are tired and want people to take individual responsibility?
I do think that is a component of it. There's many different crises in the world that donors are trying to address. That we are trying to build health systems generally. We're trying to address crises. So there are many demands being made on external aid. But the problem is that often there's changing priorities for the development partners. So what's the flavor of the month, or the flavor of the year, or the flavor of the decade? So I do feel in a way that HIV/AIDS has enjoyed that flavor for many years, and perhaps donors are fatigued and feeling it's time to shift focus. Right. But it doesn't bode well for the countries that are dependent on that external aid for people's lives and well-being.
Just to put some numbers to this, we're told that currently donor support contributes about $15 billion. What's actually needed is $22 billion. We're not going to meet that by 2015. How are we going to plug the gaps?
Well, that is the key question, isn't it? I do feel it's all partners need to come together to discuss this issue. So government needs to look at where it can mobilize additional funding. South Africa, for example, is already putting huge amounts of public funding into the response in South Africa, and it has some fiscal space to expand that, and is going to, over the next few years, it's planned to increase by 23%. And so, and then we will continue to fund the response from the public domain. And from then on, we will need to increase the donor contributions in order to sustain the numbers of people on ART. And as well, it's the private sector needs to come to the table. So already the business sector in South Africa anyway is playing an important role, but they could definitely pick up a bigger tab, and they could be contributing more to prevention and to the treatment program. But our government, I think, is going to have to look at alternative funding mechanisms. And here we're talking about an AIDS levy. Now, I know people don't like to hear the idea of an additional tax, but that might be the only way forward. Another alternative is the financial transaction tax, where every financial transaction is taxed a minute amount, and that could mobilize quite a lot of additional funding.
Right.
So These are all alternative options that our government and that the business sector needs to look at. And as I said, I really think donors need to look at their commitments over a longer term more seriously and not change as the agenda or priorities change for them.
Where should the priorities be, Teresa? For the longest time, we were told that we need to be financing ARVs. We need to be looking at generics, it's the pharmaceuticals. Then we're told we need to find innovations like vaccines, for instance, for prevention. And then we're told that, no, actually it's awareness and helping society understand the disease. Where should the resources be allocated? Where is it most effective?
There is no one better than the other, Lerato. All of those components that you mentioned are absolutely essential. We have to treat because it saves people's lives and it reduces morbidity. So we don't have a choice really on the treatment side. Also, the treatment in itself acts as a preventative intervention and will reduce infectivity. So over 5 to 7 years, we will see the impact of rolling out treatment. But having said that, we also need to curb the new people being infected, and we need to put more money into prevention measures that work. So your obvious biomedicals are the PMTCT, your male medical circumcision, and condom promotion and so on. But at the same time, it's your behavioral change interventions, which are difficult to quantify and difficult to measure the impact. And the community support interventions are essential for people living with HIV/AIDS. So that we can't, you can't prioritize one over the other. Right. And I do feel that the mitigation, reducing the impact for orphans and vulnerable children, for poor people who cannot afford food and good nutrition to take their medication, all of those are critical. Right. So I actually can't say there's one priority we need to put our money into more. We need a balanced response. And in South Africa, the reality is that treatment is taking more and more of that response, and so the other components are being neglected, and therefore it's critical that the other partners come to the table and support your prevention, your mitigation, your research components, and so on. So that's the not so easy answer to your question.
Teresa, let's talk about how we've dealt with HIV and AIDS as society. In South Africa, we've had some of the highest infection rates on the African continent, so it just came to a point where we had to face up to it. But it's a new disease in many countries where the figures seem to be rising in countries like Nigeria, and people just don't know how to deal with it. The question of denial, the question of stigma, how pervasive is it a problem in Africa, and how are those psychological issues stopping us from dealing with this problem adequately?
Mm-hmm. I wish I could say that stigma has reduced or disappeared, but it certainly hasn't. And so people are still faced with the stigma and the negative attitudes, discrimination in the workplace, and so on. And it's something that's difficult to deal with and difficult to remove from society. However, I do feel in South Africa, where I'm more familiar with the increasing numbers of people that are on treatment, and it's now being seen as a chronic illness. It's not a death threat anymore, and it's not seen as a promiscuous disease because a large percentage of our population have it. So it's seen as something, a chronic illness that you can get, and so people, I believe, are starting to change their attitudes towards the illness. However, there's the still attitude of it's just too big for African governments to deal with. But if they don't deal with it and don't invest now and early, then the price tag becomes astronomical. And I do believe South Africa is an example where we left it too late to start the treatment program. And in a sense, now we've got masses of people needing treatment. If we had started more effectively, perhaps 5-10 years earlier, we would have seen a very different epidemic in our country. So I do believe for the countries that are now increasing, the HIV prevalence is going up, they need to act now and put money into prevention and treatment. Immediate rollout of ART as fast as possible.